Good day, sir. I am Cariel Twinkle S. Gracia from 2BSNA, and today I am going to recite the steps of starting an intravenous infusion. First thing to do is verify the IV solution order on the MAR with the medical order. This ensures that the correct IV solution and rate of infusion and or medication will be administered. And then check for color, leaking, and expiration date of the IV solution. Note techniques, precautions, purpose, and medications ordered. This knowledge and skill is essential for safe and accurate IV and medication administration. Gather all equipment and bring to the bedside. Having equipment available saves time and facilitates accomplishment of the procedure. Perform hand hygiene and put on PPE if indicated. Hand hygiene and PPE prevent the spread of microorganisms. PPE is required based on transmission precautions. And then identify the patient. Identifying the patient ensures that the right patient receives the intervention and helps prevent errors. Close curtains around the bed and close the door to the room. This ensures the patient's privacy. And then explain the procedure to the patient and ask the patient about allergies. Explanation relieves anxiety and facilitates cooperation. Possible allergies may exist related to medications, tape, or local anesthetic. Injectable anesthetic can result in allergic reaction and tissue damage. And then compare the IV container label with the MAR. Checking the label with MAR ensures correct IV solution will be administered. And then check for the expiration dates. Label the solution container with the patient's name, solution type, additives, date, and time. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Time strip allows for quick visual reference by the nurse to monitor infusion accuracy. And then maintain aseptic technique when opening sterile packages and IV solution. Remove administration set from the package. Asepsis is essential for preventing the spread of microorganisms. And then apply label to tubing reflecting the day or date for next set change. Labeling tubing ensures adherence to facility policy regarding administration set changes and reduces the risk of spread of microorganisms. In general, IV tubing is changed every 72 to 96 hours. Close the ruler clamp or slide clamp on the IV administration set. Clamping the IV tubing prevents air and fluid from entering the IV tubing at this time. Invert the IV solution container and remove the cap on the entry site, taking care not to touch the exposed entry site. Inverting the container allows easy access to the entry site. And then remove the cap from the spike on the administration set. Touching the opened entry site on the IV container and or the spike on the administration set results in contamination, and the container or administration set would have to be discarded. Using a twisting and pushing motion, insert the administration set spike into the entry site of the IV container. Inserting the spike punctures the seal in the IV container, allows access to the contents. And then hang the IV container on the IV pole. Squeeze the drip chamber and fill it at least halfway. Suction causes fluid to move into the drip chamber, and fluid prevents air from moving down the tubing. Open the IV tubing clamp and allow fluid to move through tubing. Allow fluid to flow until all bubbles have disappeared and the entry length of the tubing is primed or filled with IV solution. This technique prepares for IV fluid administration and removes air from the tubing. In large amounts, if air is not removed from the tubing, it can act as embolus. Close clamp and maintain the sterility. Touching the open end of the tubing results in contamination, and the administration set would have to be discarded. After the fluid has filled the tubing, recap the end of the tubing. And then place patient in low Fowler's position in bed. Place protective towel or pad under the patient's arm. The supine position permits either arm to be used and allow for good body alignment. Towel protects underlying surface from blood contamination. And then provide emotional support as needed. Patient may experience anxiety because he or she may fear needle stick or IV infusion in general. Select and palpate for an appropriate vein. The use of an appropriate vein decreases discomfort for the patient and reduces the risk for damage to body tissues. And then, if the site is hairy and agency policy permits, clip a 2-inch area around the intended site of entry. Hair can harbor microorganisms and inhibit adhesion of site dressing. And then put on gloves. Gloves prevent contact with blood and body fluids. And then apply a tourniquet 3 to 4 inches above the venipuncture site to obstruct venous blood flow and distend the vein. Direct the end of the tourniquet away from the site of the entry. Make sure the radial pulse is still present. Interrupting the blood flow to the heart causes the vein to distend. Distended veins are easy to see, palpate, and enter. The end of the tourniquet could contaminate the area of injection if directed toward the site of the entry. Tourniquet may be applied too tightly, so assessment for radial pulse is important. Checking radial pulse ensures arterial supply is not compromised. Instruct the patient to hold the arm lower than the heart. Lowering the arm below the heart level helps distend the veins by feeling them. Ask the patient to open and close the fist. Observe and palpate for a suitable vein. Contracting the muscle of the forearm forces blood into the vein, thereby distending them further. If a vein cannot be felt, A. Massage the patient's arm from proximal to distal end and gently tap over intended vein. Massaging and tapping the vein help distend veins by filling them with blood. And letter B. Remove the tourniquet and place warm, moist compress over intended vein for 10 to 15 minutes. Warm, moist compress help dilate veins. And then cleanse site with antiseptic solution using a back and forth friction scrub for at least 30 seconds. Do not wipe or blot. Allow to dry completely. Scrubbing motion and length of time at minimum of 30 seconds is necessary for chlorhexidine to be effective. Organisms on the skin can be introduced into the tissues or the bloodstream with a needle. Chlorhexidine is the preferred antiseptic solution, but iodine, providone iodine, and 70% alcohol are considered acceptable alternatives. Using the non-dominant hand, place about 1 or 2 inches below the entry site to hold the skin taut against the vein. Avoid touching the prepared site. Ask the patient to remain still while performing the venipuncture. Pressure on the vein and surrounding tissues help prevent movement of the vein as the needle or catheter is being inserted. The needle entry site must remain untouched to prevent contamination from unsterile hands. Patient movement may prevent proper technique for IV insertion. And then enter the skin gently, holding the catheter by the hub in dominant hand, bevel side up, at a 10 to 15 degree angle. Insert the catheter from directly over the vein or from the side of the vein. While following the course of the vein, advance the needle or catheter into the vein. This allows needle or catheter to enter the vein with minimal trauma and deters passage of the needle through the vein. When blood returns through the lumen of the needle or the flashback chamber of the catheter, advance into the vein until the hub is at the venipuncture site. The tourniquet causes increased venous pressure, resulting in automatic backflow. Placing the axis device well into the vein helps to prevent dislodgement. Release the tourniquet. Stabilize the catheter with non-dominant hand. Bleeding is minimized and the patency of the vein is maintained if the connection is made smoothly between the catheter and tubing. And then remove protective cap from the tubing and attach it to the catheter by not touching the point of entry of connection. Secure the connection. Begin a primary infusion by slowly opening slide clamp or adjusting roller clamp of IV tubing. Inspect the insertion site for signs of infiltration and leaking. Infiltration and or leaking and patient reports of pain and or discomfort indicate that the insertion into the vein is not successful and should be discontinued. Open and apply the skin protectant to the site, making sure to cover at minimum the area to be covered with the dressing. Skin protectant aids is adhesion of the dressing and decreases the risk for skin trauma when the dressing is removed. And then place sterile transparent dressing over venipuncture site. Transparent dressing allows easy visualization and protects the site. Stabilization or securing devices preserve the integrity of the axis device and prevent catheter migration and loss of axis. Some stabilization devices act as an site dressing also. And then loop the tubing near the entry site and anchor it with tape close to the site. The weight of the tubing is sufficient to pull out of the vein if not well anchored. Non-allergenic tape is less likely to tear fragile skin. If infusing by gravity drip, advance flow rate to correct drop per minute. Adjust until the correct drop rate is achieved. Label the IV dressing with the date, time, site, and type and size of the catheter used for the infusion. Other personnel working with the infusion will know what type of device is being used, the site, and when it was inserted. IV insertion sites are changed every 48 to 72 hours or according to the agency policy. Apply an IV securement or stabilization device based on facility policy. Explain to the patient and the purpose of the device and the importance of safeguarding the site when using the extremities. These systems are recommended for use on all venous axis sites and particular central venous axis sites to preserve the integrity of the axis device and to prevent catheter migration and lost axis. Some devices act as a site dressing also and may already have been applied. Remove equipment and return the patient to a position of comfort. Lower the bed if not in lowest position. This promotes patient comfort and safety. Dispose of used stylet or other sharps in appropriate sharps container. Discard supplies, remove gloves and PPE if used, and perform hand hygiene. Removing PPE properly reduces the risk for infection, transmission, and contamination of other items. Hand hygiene prevents transmission and of microorganisms. And then document appropriate information of the patient's chart. Return to check flow rate and observe the IV site for infiltration 30 minutes after starting the infusion and at least hourly thereafter. Ask the patient if he or she is experiencing any pain or discomfort related to the IV infusion. Continued monitoring is important to maintain correct flow rate. Early detection of problems ensures prompt intervention. That's all. Thank you.